Good evening, myself Dr. Manjula Jayaram, consultant physician and diabetologist, Rela MS Hospital, Redditch. Today, we'll be discussing about a most important topic, diabetes peripheral neuropathy. So, as we know, diabetes is one of the most common non-communicable disease prevalent globally, and India, it is a capital of diabetes. So, there are many complications, and more commonly, what we see is diabetes peripheral neuropathy. So, in this video, I'll be discussing what are the steps that we can do in order to prevent diabetes peripheral neuropathy. So what happens is when the sugar levels are high, it usually causes damage to the nerves and also to the blood vessels which would supply the nerves. So the end results would be peripheral neuropathy. So the patient presents to us with signs and symptoms such as burning sensation, there'll be numbness and tingling. So how do we prevent this? There are multiple lifestyle changes that we will be able to do in order to prevent patients of diabetes going into peripheral neuropathy. The first one I would say is control of blood sugar level. When there is increased chances of developing peripheral neuropathy will be high in a patient with poor glycemic control. So a tight control of blood glucose would prevent them from developing neuropathy. And second, I would say is exercise. By exercising, overall complications of diabetes would come down. Definitely, it would increase the blood supply to the nerves as well, and thus the chances or the prevalence of developing diabetic peripheral neuropathy would decrease. And the third thing I would say is food hygiene. So, food hygiene is very much important. You have to keep, like the patient with diabetes, have to keep monitoring or checking their food for any minor injuries. They have to wear some comfortable shoes and socks to prevent any injuries, or they have to have a frequent visits to the doctors so that they will be able to pick up any diabetic food early. And the foremost thing I would say is to prevent consumption of alcohol or smoking. Actually, smoking and alcohol per se would cause development of neuropathy even in a non-diabetic. So when the patient is diabetic with a poor glycemic control, if the patient still continues to consume alcohol, or if they continue to smoke, the blood supply is invariably going to come down. The blood supply to the nerves will come down, and then results would be peripheral neuropathy. So I would conclude saying that patients with diabetes, in order to prevent complications, they have to have following things. One is a good tight control of glucose. Second thing is regular exercise, at least for about 30 to 45 minutes per day. To quit smoking, abstinence from alcohol, and the last one is food hygiene, that is regular checking their food or visiting, having a regular follow-ups with the doctor in order to diagnose the diabetic foot or peripheral neuropathy early. Thank you.